We are about to recognize some very distinguished guests with us today. The clerk will read the caption to House Resolution 953.
House Resolution 953 by Representative Taylor of the 173rd Group of the 43rd, Hardin of the 148th Parish of the 158th, Green of the 151st, and others. A resolution recognizing February 1st, 2018 as Community Health Centers Day and commending the Georgia Primary Care Association and for other purposes.
Chair recognizes Chairman Darlene Taylor for an invite resolution.
Thank you, Mr. Speaker. Members of the House, today is Community Health Center Day. The mission of the Community Health Center system is to improve access to comprehensive health care services for the medically underserved of Georgia. Community Health Centers of Georgia began to work over 40 years ago, partnering with communities to bring this access of important health care. It's very important, especially in our rural communities. Currently, there are 34 separate, distinct health center organizations. All are nonprofit 501(c)s. They have their own directors, and that board of directors is made up of patients as well as community leaders. Over the past 15 years, Georgia has experienced tremendous growth in the health center systems. In 2017, over 600,000 patients were served by our Georgia community health centers. From an economic standpoint, and as a system of outpatient health centers, Georgia's community health centers employ nearly 3,500 employees, and the payroll is $135 million. I want you to know that the Medicaid dollars that we spend are a savings for the state budget. They are able to operate at less and save money for us, also by controlling chronic disease and by making a reduction in the number of unnecessary ER visits. As you can see by the map that each of you have on your desk, you probably have a center in your community. If you don't, they're using a neighbor community. We appreciate all that they do, and for not just us, but our districts and all the people of Georgia. Today we have a special day to congratulate them, and with us today are some of their leaders. Thank you for what you do and what you do for all of Georgia. Today, please help me welcome Dr. Brian Williams, the president of the association.
Mr. Speaker and distinguished members of the House, it is my pleasure and honor to stand before you today representing the community health centers in Georgia. Thank you for recognizing the community health centers and for your support over the past 40 years. The community health centers throughout the state operate in medically underserved areas, often the only healthcare provider in rural communities. And last year we provided health care to over 500,000 patients in the state of Georgia. The community health centers meet the need of the community, meet the needs of our communities. Thank you again for your commitment, for your ongoing support, and for your enabling us to be able to provide local care to the residents of Georgia. Thank you.